Diverticular disease is a condition that affects the large intestine. It is characterized by the presence of small pouches, or little sacs that protrude from the wall of the colon. My name is MediStop. Welcome to my channel. In this video we will talk about a medical condition called diverticular disease, a common pathology that becomes more frequent with age, and it is more common in people over the age of 50 years old. The spot where these sacs are usually found is right from the wall of the sigmoid colon. There are two types of diverticular disease: diverticulosis and diverticulitis. Diverticulosis refers to the presence of these sacs without any inflammation or infection. This is a very common situation. In fact, by the age of 80, it is estimated that over 60% of people can have these pouches in their colon. On the other hand, diverticulitis occurs when these sacs are inflamed or infected. What causes this event? Basically, diverticulitis appears when the opening of a diverticulum becomes too narrow. This obstruction will eventually block the fecal matter and will let the microorganisms from the colon to multiply and to determine an infection. This blockage can also cause an inflammation, or even worse, a perforation of the layers of the large intestine. Depending on the severity of the situation, diverticulitis can be complicated or non-complicated. The difference between these two is made mostly by the presence of new clinical features for the complicated diverticulitis. What signs and symptoms can have a patient with diverticular disease? Let's see the clinical signs and symptoms for both of them. For the non-complicated diverticulitis, the symptoms can be acute abdominal pain, especially in the lower abdominal corner; fever, which is a sign of inflammation or infection; transit disorders, which is basically an alternation between constipation and diarrhea. Moving forward to the complicated diverticulitis, the clinical features are mostly the same but more severe. In addition to that, there are some complications caused by the obstruction of the diverticulum. The patient can experience abscesses, fistulas, or even signs of peritonitis. However, the most frequent complication is the fistula between colon and bladder. It is more common for men than women, and because of this communication between these organs, we can see two important signs: urinary infections and pneumaturia. Pneumaturia refers to the presence of gas in the urine. This gas is produced by those microorganisms found in the feces that have arrived there through the fistula. How can you diagnose diverticulitis? The diagnosis of diverticulitis is mostly based on the usual clinical features. In plus, an ultrasound examination can be used, especially because of its high sensitivity for abdominal inflammations. But for certainty, a computed tomography of the abdominal cavity can be useful. On top of that, for those who need a surgical treatment, a colonoscopy can be used, especially if you want to distinguish a diverticulitis from a type of cancer or colitis. Here I will make a short pause. This is just a reminder. If you liked this video so far, subscribe to my channel to receive more content like this. How can we treat this illness? If we are talking about diverticulosis, this is an asymptomatic condition which has no mandatory treatment. However, if we are talking about diverticulitis, it is important to know the severity of the disease and if there are any complications involved. If the illness is not so severe, we can go for a more medical therapy, like the parenteral hydration and the administration of antibiotics for 1 week. In more severe cases, surgery will be needed. Usually the part of colon affected will be removed. Then the surgeon will make an anastomosis between the remaining parts. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, Hit that subscribe button to never miss more content like this. Thank you for watching. See you in the next one.